It's really nice to be here today. I believe most of you have a connection to Spiritism and to maybe Brazil. Is that right? Yes. And I should say I went to Brazil the first time just after I finished residency and as a new young faculty member and medical director, and had some really formative experiences in Brazil. I love Brazil. And I was deeply affected by Allan Kardec's Spiritism. It's a very beautiful way of understanding the world and has had a profound influence on me over the years. So I appreciate that a lot. So thank you. And I was just in Teresina several months ago, so I'll be touring, when my book comes out in February, I'll be touring Brazil again and many other parts of the world, so I'll look forward to that. So, thank you for being here today. Can you hear me okay? Okay. So, it was really Brazil where this research started for me. There was a nurse at a hospital in Boston, Mass General Hospital, who had pancreatic cancer. She was an oncology nurse, and she went to a healing center in Brazil and believed that she was starting to obtain a healing from her pancreatic cancer, and began calling me, telling me that I should come to Brazil and begin studying the healings that were going on. And I said no. I was concerned. I didn't think anything was probably really going on. That wasn't the way I'd been trained. I also didn't want my colleagues to become concerned about me. And so what she did was she had people began calling me from around the country and the world saying that they had medical evidence for their recoveries, and did I want to see the evidence? And I initially said no again, but eventually I began to realize the medical evidence suggested that something was going on, and so it was really that nurse and Brazil that really got me going down the line of this research. So I have a lot to be grateful for with all of that. So I've been gathering medical evidence for stories with remarkable recovery since 2003, and I have had three criteria for the research. There had to be a genuinely incurable illness according to all that traditional medicine understands, and there had to be medically indisputable evidence for accurate diagnosis, and then clear documented evidence of recovery. And there couldn't be any complicating factors such as an experimental medication or anything else that could potentially explain how they got better. So at this point, I have seen many, many cases of people who've gotten better when they were told they were going to die. If you're on the science side, you call this spontaneous remission, and you're taught since medical school that this is a fluke with no medical or scientific value. If you are on the religious or spiritual side, you call it a miracle or spiritual healing. But I believe that all of these terms are black boxes that we've never used science to really unpack and understand. Am I going too fast? No. Okay. All right. So one of the things I've realized is there's nothing spontaneous about spontaneous remission. The word spontaneous means without cause, and what's rather fascinating is that we've just assumed that these cases just come out of the blue, and the truth is these people across many different kinds of diagnoses have done very similar things, but it's just that we never asked. Common sense suggests that we should be studying these people. It makes no sense that we haven't done so up to now. It's an uncharted wilderness, so I feel very privileged that I get to be a part of looking into this. So today, we are going to talk about the power of stories to provide ethical, grounded hope. Doctors are taught to not provide false hope, and I think that's important, but ethical, grounded hope that's rooted in real medical evidence is a very different kind of hope. And I think we have a responsibility to also provide ethical, grounded hope for people who have lost hope. I'll tell some stories today. And since I think pictures are really powerful, I'm using some stories not just of incurable illnesses, but also some stories of really amazing adaptations There are amazing stories out there that are just not told, and there are people who are doing amazing things to recover their health and to help others recover health. And so I'm going to tell some of those stories as well. What's really exciting is I think that we are at the end of an era and at the beginning of a new era. Doctors are taught to diagnose disease and prescribe medications, but by and large, the era that we've had during the industrial age has been simply diagnosis and medications. It has not really been about studying healing for the most part. And so now we have a new era opening where we are now starting to study how people heal. And I think these are the most amazing cases to study, are these people who have really beaten the odds. I think if we do this well, we can open up a whole new era where we have a science of health and healing. I don't know what your medical care is like in Switzerland and where you've come from, but in the United States, this is definitely an issue. It's the only treatment option he has under his current health care plan. I'll start with the story of Emily Bowler. Emily didn't really have incurable illnesses, but she has great story and great photos, and she did the same thing that I see in all of these cases. So I'm going to tell her story because photos are important. Emily is an artist by training. That's what she does, is art for her work. She was in Italy looking at the statue of David that was carved by Michelangelo, and she was really upset. I guess she said there's something about mud had been smeared or something, and she was really upset that a beautiful piece of art could be effaced. And then it hit her like an epiphany. She realized that she had been putting mud, toxic thoughts and toxic foods into her body for her entire life. And she decided at that point she was going to change her life dramatically. This is a story about the power of nutritional density. You can see from the middle picture, that picture in the middle was taken in July of 2008. At that point, she had been through a lot. She'd been through a very traumatic childhood. She'd struggled with eating disorders her entire life. She'd been through the suicide of her son and was weighed down at that point by a lot of anxiety and depression. She had heart disease. She had high blood sugar. She had high blood pressure, high cholesterol, and was on quite a long list of medical and psychiatric medications. This was around the time of the trip to Italy, and she read a book that was very powerful in changing her life called Eat to Live by Joel Fuhrman. I don't know if you know that name. Joel Fuhrman, Fuhrman, is a fabulous book, and he is one of the few really bright, clear voices in the United States around, I think, what real nutrition is, because I think there's a lot of confusion, at least in the United States, about nutrition. And I know as doctors and even nutritionists in our country, we get a lot of miseducation about what nutrition is. I think he's a good voice on this. She read the book and realized that nutrition is not about counting calories. It's not about food groups. It's not about portion size. She realized that it's really about making sure that what you eat has a lot of nutrients in it. And so just that simple statement meant that she had to get rid of a lot of the foods that she was eating that had empty calories and were processed foods. So July of 2008 is the middle picture. July of 2009 is the picture on the right. That's 12 months later. 12 months later, she had lost 100 pounds and her heart disease was gone. Her blood sugar was normal. Her cholesterol was normal. Her blood pressure was normal. And she no longer needed to take any medical or psychiatric medications. She has since continued to thrive. In the last 10 years, she has just continued to find her voice and her path. And she had a book that just came out several months ago called Starved to Obesity. And it's a great story because in sharp contrast to what I was taught in medical school, where we were told that nobody in the Western countries suffers from malnutrition, She has come to really believe, on the basis of Joel Fuhrman's work, that most of us have malnutrition, and that's why we struggle with a lot of diseases. It's a tragedy that when the Western diet is exported to more and more countries, the rates of heart disease and diabetes and cancer and autoimmune illness, they don't just go up, they go up exponentially. And I think that's a real problem. I know that's happening in Greece right now. I have a friend who is a physician and has a farm there, and he said that in Greece, in the outlying outside of Athens, people still eat the Mediterranean diet, which they've eaten for centuries, and is, generally very healthy. Fish and vegetables and wine and all that. And in Athens now, it's cool to get a cheeseburger with fries and a soda, and the rates of disease are skyrocketing. So it's tragic. So that's just a brief glimpse into Emily's story. This story I do tell in my book. It's a wonderful story, June Stein. I tell her story in the book in part because when you're taught in med school that spontaneous remission is a fluke, when you have 3 cases of spontaneous remission in one family with widely different diseases, it's just one other thing that makes it hard to think that that's the best way to understand it. But June is a lovely lady. She was diagnosed in her 20s with a disease called ankylosing spondylitis. And basically what happens with that disease is calcifications begin in your pelvis and creep up your spine and basically turn you into an immovable concrete mass because your bones freeze together. We twist and turn with our back, and our pelvic bones, they all twist and move for us all day, all the time. And to be frozen in place so that you can't move is a really difficult thing. And she wanted to have children. She had a great marriage. She wanted to enjoy her life. And so she had a great statement. She said, "I accepted the diagnosis, but I refused to accept the prognosis." She was diagnosed correctly. Her body did start to descend into a lot of pain and immobility, but then she decided she was going to try some things. She changed her nutrition a lot. She did the same thing that Emily did in terms of really starting to eat much healthier foods. And she also decided that she needed to deactivate the amount of stress in her life. And so she worked very hard to get out of the chronic fight or flight or freeze that characterizes many of our lives, I think, in Western culture. And you have to in order to fully heal, you have to get out of the stressful state of fight or flight into a more healing parasympathetic state. And she worked very hard to do that. She began going to yoga as a way of learning how to relax her mind and her body. And it began a long journey for her. And even though there's never been a case known of recovery, I can tell you that she is not somebody who's frozen into an immovable mass that cannot move. You can see that she's more flexible than certainly I am, and probably more flexible than most of us are. And she has been completely disease-free now for over 30 years. She is a vital, lively, very engaging woman, and she, like every other person I've ever talked to, is so grateful for the disease now because she said it so fundamentally changed her relationship with herself. And so what happens in the process of these healings, it's a complicated thing, but people come into such a different relationship with themselves. They give up a lot of self-defeating thoughts and fears, and there's something very liberating about coming to have a very different set of beliefs about who you are and who all of us are. So she's an amazing woman to talk to in that sense. Her husband and son have amazing stories too with very different illnesses. Her husband was written up in a journal of neurosurgery for his healing of a blood vessel in his head that was a real problem and a risk for him. And he used the same techniques that his wife did, that she basically taught him. And doctors were shocked that with the intense work that he did with changing his relationship with stress and nutrition, that within 2 months he was able to heal this big problem in his brain. It was an aneurysm. So, on a different note, I'm going to tell a different kind of story because I think these kinds of stories are really important as well. Dana Lewis had very brittle diabetes and was at risk of not waking up when she would go to sleep. So she had a very difficult time letting herself sleep because she knew that her diabetes was so brittle, her blood sugars would go up and down so fast that she was at risk of dying in her sleep. So she decided to create an open source artificial pancreas. And basically what it is, she developed a software that replicates and can monitor and regulate the blood sugar in her body itself. And so now she sleeps very safely at night, and she can hike, she can exercise, she can live a relatively normal life that she did not have the possibility of doing so before. It has changed her life, and the fact that she made it open source is very exciting. There's many people around the world who are taking her open source artificial pancreas and adapting it to their own needs. So I spoke in Austin, Texas, University of Texas, at a do-it-yourself medical conference with all these patients who are not waiting for medicine to come up with the solutions for their health problems. They are inventing the solutions for themselves. And I think that's a really exciting step, and it bodes well for the future because people are taking the power, saying that we are going to be the experts on our lives and our bodies, and they're inventing incredible solutions. There's a guy who invented a surgery that saved his life. He's now a motivational speaker. There's great stories out there, and I think they need more of a platform. They need to be told, because when these stories are told, people say, well, if that person can do that, I can do this. So I'm going to tell you a story about somebody you've all heard of, probably, Stephen Hawking. Great physicist. He was diagnosed at age 22 with ALS, with Lou Gehrig's disease. He was told that he would be dead within 2 years. He lived for another 55 years and died at age 76. He died just last February, I believe. And he has an amazing story as well. He didn't recover from the illness, perhaps, but he lived so much longer than was thought to be medically possible. He attributed his amazing longevity to a sense of humor and to keeping his mind active. We do know that he kept his mind active. And his sense of humor. He was on a show on HBO by John Oliver. And John Oliver is a comedian, and so they were talking about parallel universes. And John Oliver said, so is there a universe out there where I'm smarter than you? And Stephen Hawking said, yes, and also one where you're funny. And then John Oliver he said, well, is there a parallel universe out there where my alter ego is dating actress Charlize Theron? And Stephen Hawking said, no, that's beyond the bounds of scientific possibility. So, but Stephen Hawking was an amazing individual. He was trapped in his physical body in some ways, but people who know him, I know someone who knew him very well and who says that, but when you see the life and the vitality in his eyes, you knew that he was an unusual individual. He was very vital and alive. And I'm associated with Singularity University out in California, and they do some fascinating work on the leading edge of technology and medicine. And they were able to get permission to take him into space. And it was a lot of drama, but it's a great PR stunt. And Stephen Hawking got into space. They had to get all kinds of insurance policies because the FAA refused to allow it, and lot of issues, but they finally were cleared to do it. And then to be so much less confined by his body was a great experience for him, so he didn't want to come down. So they did something like 9 loops in sub-G gravity, and he had a fabulous time. Another story that's really telling, that is really instructive for us, I believe, is Amy Mullins. She was born a double amputee, and yet she has refused to see that as a disability. And she was the first person and the first woman to participate in normal NCAA sports in the United States. And she not only participated, she set records. She has a TED Talk that I think she talks about having 10 or 12 pairs of shoes. She has a pair of prosthetic limbs for athletic work. She has a pair of limbs for when she works as a model. She has a pair of limbs for when she is dancing. And she has worked really hard to help people understand that prosthetic limbs do not need to be just functional. They should be objects of beauty, and there's nothing to be ashamed of. And she's one of the most empowered and empowering women in the world. I know that she was on Dancing with the Stars. I never saw her there, but I've heard it was quite a thing. So she has a great quote here. I think this is a really good perspective. She has started a new conversation about the way society looks at disabilities. It is no longer a conversation about overcoming deficiency. It's a conversation about potential. A prosthetic limb doesn't represent the need to replace loss anymore, so people that society once considered disabled can now become the architects of their own identities, and indeed continue to change those identities by designing their bodies from a place of empowerment. It is our humanity and all of the potential within it that makes us beautiful. That's really different than the way doctors and people in medical care have been trained to look at things. We have a more pathology-based view, and I think the future is to see and to begin with what's right with people, with what's amazing and magnificent, and realize that there's something magnificent within all of us, and that when you start from that place, you see disease very differently. Rachel Donalds is my partner. She also has her own story. While she was at the School of Public Health, she was diagnosed with Hashimoto's thyroiditis, which is a problem with the thyroid. She was told that, well, when your thyroid cells are all basically dead, then we can put you on synthetic hormone for the rest of your life. She didn't like that answer. And so she changed her nutrition as well. She changed her relationship with stress. She developed an app that would help her realize when her body was in a stressful state, in fight or flight, and then she could then begin to change her stressful physiological response. What's amazing is that most of us are not usually aware of how stressful our body is registering things. And so we're not often very aware of how much the stress hormones are active, and that is a problem for our health at lots of levels. So she developed an app that now has the potential to help lots of people and help people get out of these stressful states. And I think that's an amazing thing. And then even to have a social community around that. And she also is healthy now and does not have to go on the Synthroid or on the hormones, which is fabulous. So there's lots of stories out there. Once you start talking about these stories, whether it's near-death experiences or remarkable recoveries, you start to realize that there's a lot of stories that don't get told in our culture. Sometimes people are afraid to tell the stories because they're afraid they'll be called crazy or considered crazy. And so these stories are really important. But we could talk all day and night about these amazing stories. So, like we mentioned just briefly a little while ago, the industrial age was really about the identification of diseases. The questions that you begin an era with are what defines the era, and the beginning of the industrial age was really about trying to just recognize and distinguish the signs and symptoms of one illness from the signs and symptoms of another illness. And so it was really an age of trying to just name diseases and recognize them and and just have a name for them. And then I think we are at the end of that era. I think the disease model was helpful in the sense that it was a distinct step forward. It took illness from the church and began this long evolution of beginning to say you can't blame people for having an illness. You can't say that it's a judgment from God or the result of sin. You can't do that. That's not how it works. So it weakened that tendency. We still have a ways to go with that, but it began that process. But it's still a science of disease and not a science of health and well-being. Doctors are trained in disease diagnosis and medications, but we're just on the very early steps of beginning to even study health and well-being and even name health and even name well-being. So I'm not against medications. I use medications regularly, sometimes aggressively when a person's in a delirium in the ICU, et cetera. But we have more than just our biology to us. We are all of two natures. We are biology, but we also are these higher dimensions of spirit. And it's often important and more helpful to also engage the deeper causes. The brilliance of Western culture is that we send a person with a medical problem to the medical doctor, we send a person with a psychological problem to the therapist, and we send a person with a spiritual problem to the priest, rabbi, imam, or minister. That's all brilliant and allows everyone to be able to go into their own little piece of things. But what we don't do very well is stand back and see the big picture. And I don't think the spiritual is really a piece of the pie in the way that a medical problem is a piece of the pie or a psychological problem is a piece of the pie. The spiritual really permeates everything, I believe. And so I've had so many people say things to me in the emergency room or in the medical floor. They feel like God lost them in the crowd when they were born, or that God lost them a long time ago. And the way a person feels about themselves and the world at a deep level, whether conscious or unconscious, is a massive factor in terms of what's available to them for healing. So, I think what's really exciting is as we start to study health and well-being, it's also a lot of other things shifting that are related to that that's helping people take charge of their own health, whether it's in the do-it-yourself movement or in beginning to change nutrition, change your relationship with stress, change your relationship with the immune system. That's a big topic. We'll talk more about that tomorrow. And also even begin changing our beliefs. More and more, we are not limited to the little village or the job or the beliefs of our parents and grandparents. We have a very different life, and the opportunities there are that we can create our own life and our own beliefs and our own careers. But changing our beliefs is a thing we'll talk more about tomorrow, because I think I've seen so many people not change their nutrition, not change their relationship with stress, and they still get better. And where the real money is on healing is having a deep experience where you really realize and experience a deep change in your beliefs. And we'll talk more about it because it's a really big topic. But part of what all this is about is we're helping medicine move away from passivity, from teaching patients to be just lie in their bed and wait for the doctor to prescribe medications. We're moving into an era where people can take charge of their health and become healthy. Our smartphones, more and more, are becoming like the tricorders on Star Trek, where the power is within the person and with apps and that sort of thing to really start to track their health and make changes. So, I'm a big believer that we need to treasure the exceptions. We need to study those people with remarkable recoveries. When we don't pay attention to the exceptions, we don't realize what's possible. Treasure your exceptions. When there are none, work gets so dull that no one cares to carry it further. Keep them always uncovered and in sight. Exceptions are like the rough brickwork of a growing building, which tells that there is more to come and shows where the next construction is to be. We study ultimate achievement in sports and business. We are fascinated by what Serena Williams, and at least in New England, Tom Brady, and Michael Jordan, and Steve Jobs have done, and we should be studying this in health instead of disparaging it. So it's a mistake to dismiss cases simply as being flukes or anecdotes. It's not scientific to assume that they occur out of the blue without cause. They are priceless treasures that may hold the keys to a cure for some diseases. And as we said, the industrial era was the era of disease. We are now entering an era of health and well-being, and that is a big topic, requires improved scientific methods. And we can go really deep into that, but we're pretty late, so I'm wondering if I should stop.
On peut continuer, il n'y a aucun problème.
Okay.
Oui.
All right.
On va essayer de sauter la pause et à la fin, nous aurons la possibilité de poser des questions. J'imagine qu'il y a beaucoup de gens qui sont intéressés de poser des questions. Vous pouvez garder ces questions pour après. Et on va enchaîner les deux présentations peut-être?
J'ai besoin de 5 minutes.
OK.
Parce que je veux suivre sur mon écran les slides, pas tourner, et ils peuvent.
D'accord. Mais ça serait dommage de rater l'opportunité de voir toute la présentation. Donc, we're really looking forward to having your entire presentation, not just cutting it because of the time.
All right, thank you. So let's go into the science of this a little bit. There have been a few studies on spontaneous remission, and they are courageous studies. They're very good, but they're also loaded with lots of problems because I think, honestly, to start studying well-being means that we have to revise the scientific method in some ways. And that's a really big topic. We won't go into all that, but it does mean that we have to begin changing how we think about the methods of science even. Science is brilliant in some ways, but it's also science does lots of studies with medications and different methods, but it doesn't look at the amount of effort that a person puts into that method. For example, if lots of people take a medication, you can look and see what their response is to the medication, see if that medication is helpful for that particular disease. Or you can now, we're having a growing number of meditation studies and yoga studies, and those are helpful too. But it's my belief, see, the people that I study, normal scientific studies are built around the average. They're built around the mean. And so all of the people that I study and that we're talking about today, they get screened out in the data. They don't fit. They're way off over here. They're not part of the normal curve. And so I'm saying we got to change our methods because we got to start studying these people that are not part of the normal curve. If I was ill, I'd like to know what the average person does, but I'd really want to know what the people who have beaten the odds do. And so I'm very interested in having a scientific method that captures these people who are not part of the normal curve. And to do that implies a lot of changes because you then have to start looking at the quality of a person's relationship with the method that you're trying to study. And that really shakes things up. So Frankel did some really brilliant work in both Texas and Israel. He looked at a number of different cancers, breast, colorectal, pancreatic, ovarian, glioblastoma multiforme, which is a brain cancer, and others. And a fascinating study. The biggest thing that he found in 2011, the biggest factor that was associated with these people who got better was that they were personal activism. They were very interested in taking charge of their health. And that came out in several different ways. They took charge and got involved in the process of diagnosis and treatment. They wanted to know, they got second opinions, they got third opinions. They were not just the good patient. Sometimes they were willing to shake things up because they felt like they needed to not just be told what to do, they needed to be an active participant in the process. They experienced a change in their philosophy of life. And so it wasn't just that they were getting medical treatment. They made some deep changes in their own viewpoint of themselves and the world. The activism was assessed and captured in several other ways as well. They were very active in getting information about what they were dealing with. They played an active role in selecting their treatment team and choosing the therapy that they thought was right for them. They made attitude changes, they made lifestyle changes, they worked on living in the present. You know, there's that saying that depression is about living in the past and anxiety is about living in the future. They worked really hard to find that middle spot of really being alive in the present now. But it's fascinating, you know, there's no way to tell from this study whether some people made all of these changes and still died. Were there people that did the same thing as the people who got better and still died? That's a big question. And so there's one person from Toronto who has really looked into this. Cunningham at the University of Toronto is, I believe, has done the most important research in this area up to this point. He is an unusual individual because he is both a psychologist but also working in a medical clinic with breast cancer. And so he is crossing that mind-body divide that really has restricted so much of medicine. He's a psychologist in a breast cancer clinic. And there's another way in which he's unusual. He is working with cancer, but he also was a cancer patient himself. And so he had colon cancer, so this was not just a professional journey for him. He also found a way to recover from his colon cancer. And so I think these different paradoxical things that he held together in his own life made him much more able to understand the limitations of the research that, the limitations of science has been experiencing in terms of really capturing this phenomenon. And so he began to put together some fabulous studies. There was a famous study by David Spiegel out in Stanford a number of years ago that you were a part of, I believe, at some level.
I was part of the replication study.
Okay, the later replication of it. And it's fascinating to me because that study I think was done in the mid-90s originally, I believe, and was with breast cancer patients and got a lot of publicity because it demonstrated that women with breast cancer who got into group therapy lived, I think, 18 months longer on average. And Cunningham looked at that study and he said, I don't think that's accurate. And he was one of the few who really understood that there was a problem with the method of studying this. So he replicated the study, or he did the study again, and there's a lot of people who tried to replicate the study. The study's never been replicated, and there's some interesting issues with the study, but it's complicated why even Spiegel himself was never able to replicate it. Once he got more funding, he did a big study that you were a part of years later and wasn't able to replicate it. And I think Cunningham is one of the few who understood what the real issues were here and understood that there were people who were probably having some remarkable recoveries, but by focusing on the averages, they were not getting to the real issue. And he said, you have to look at the way in which the person's relationship is with the method. Some people, just like in school, some people will pay a lot of attention and work really hard in math class, and other people will never show up and just not work at it. And so you have to ask questions and really pay attention to, is the person doing these strategies with real personal involvement or just doing it because they're getting paid $50 to be part of the study? And so he was the first one that really began to look at that carefully. And he noticed that 9 subjects in the study were very involved. He put more than 100 hours into every single individual in this study. And so it's a very labor-intensive study, very sound from a methodological standpoint, looking at biomarkers, and they used a lot of qualitative analysis with people who were not part of the study, independent. It did a lot of, made it as objective as possible, and found out that there was 9 people who were spending regular daily time, often several hours, devoted to relaxation activities and meditation, using mental imaging as well, cognitive monitoring and journaling. And so they were not just doing what was going on in the study and being studied, they were doing stuff on their own and really invested in this because this is their life at stake with the cancer. And all but one of those people had a good quality of life and lived at least 2 years. 2 had complete, unexpected 8-year remissions at the time of publication. At the other end of the scale, there was 8 subjects who were less involved, either unconvinced that self-help would help them or were hampered by psychological issues such as diminished self-esteem. None of them had a good quality of life. Only 1 lived more than 2 years, though their medical prognoses were no more unfavorable at the onset of therapy than those who were in the high involvement group. So how you apply yourself, which makes sense, how you apply yourself is going to matter. And this is the first study that ever looked at that went beyond just looking at what the person did, but actually looked at how involved they were in doing it. People who were highly involved with self-help tended to live nearly 3 times as long as those with low involvement. I think all of this is exciting because we're now starting to get a much truer understanding of health, whereas just 20 years ago, it was all the talk about how genetics was going to solve everything, and the real answer was in genetics, as we were talking at lunch. Now we know that it's really 90 to 95%, the studies later are saying 95% of life and illness is really lifestyle related and not genetic. So there's a very small proportion that's genetic, but everything is really mostly lifestyle. Now there will be some genetic stuff that you can't change, maybe the hardwire in your body so much, but most of it we are finding in the future is to start realizing that most of our illnesses are really lifestyle based. You know, epigenetics, is that a word that's familiar? Where our lifestyle can turn genes on and off. Our beliefs can turn genes on and off. That's a big statement. It takes more work, but it's a lot more to that. The science of epigenetics didn't exist when we were thinking genes determine everything. It was a very deterministic, reductionist way of understanding things. So, conditions associated with longer survival in Cunningham studies. Sufficient flexibility and dedication to make an active response to the diagnosis was important. These people made changes in habits of thought and activity, relaxation practices, meditation, mental imaging, cognitive monitoring, which means basically you monitor and see if you have self-destructive thoughts or self-disparaging thoughts, and you change those thoughts and beliefs. And becoming involved in a search for meaning in one's life was also important. There were conditions associated with poor survival as well. Inflexibility associated with low self-esteem or fixed worldview that the subject saw no reason to alter. Skepticism about the potential impact of psychological self-help techniques or one's ability to apply them. Other activities just simply seemed more important or immediately appealing. And this is something we often see too. Meaning was habitually sought outside of the person rather than through internal searching. Or the person had strong contrary views about the validity of spiritual ideas. Or they had a need for control so strong that recommended changes were rejected. This gets into some deep psychological things that you really do see clinically. So, I'm going to wrap up. Tomorrow we'll talk more about 4 factors that I believe are critical in these amazing recoveries that I've seen. One of them is nutrition, which we've touched on. The second one is you have to heal your relationship with the immune system. And we'll talk more about that. The immune system is a very powerful part of our body, and to rely exclusively on weakening the immune system with immune suppressants to suppress the immune system, or to use Tylenol to get rid of your fever. We'll talk more about all this, but it's a fascinating thing that if our only tool is to suppress the immune system, you're going to end up with a weakened immune system. So it's fascinating to me that you can actually track the number of times a woman has taken antibiotics in her life is directly correlated with her risk of breast cancer. So it's not just that antibiotics are associated with breast cancer, it's that the number of times you've taken antibiotics increases your risk of breast cancer. So that's a complicated thing, but I do believe there's a lot of signs showing that I'm not against antibiotics. There are times I see every day them save lives, but to rely on antibiotics instead of strengthening our immune system, I think is really wrong-headed, and we'll get into that tomorrow. So, and then the fourth thing you have to do, I believe, that's associated with these remarkable recoveries is you have to heal your beliefs. You have to heal your identity. These people are always grateful for the illness because of the way in which it so fundamentally changes their relationship with themselves and with the world. And I think when we go into these illnesses, we don't always realize what beliefs that we have, consciously or subconsciously. And these people who have really taken a look at what their deep beliefs are about themselves and the world and really changed those beliefs, that's where the money is. I mean, it's fascinating to me because I can tell the stories, and I tell the stories in my book on purpose. There are people who do not change their relationship with stress, who do not change their nutrition, who don't change their immune system, the strength of their immune system, and they still get better because they heal something in their identity. And that's a really, really big topic, and we'll try to dive into that tomorrow a little bit. So in conclusion, finally, this is the beginning of a new era. And it's really exciting to me that all around the world, there's this subconscious and conscious shift away from just studying disease and to really start to name well-being, to start to build our lives on what's right and special about each one of us, and to take that more seriously. And that means also taking nutrition more seriously, and the immune system, and self-help, and taking charge of our health. So we're at the end of the era and a beginning of a new one. So we need a science that helps us develop flourishing, vital lives of meaning and genuine self-value, focused on what's right about each human life, not just on what's wrong. I believe it's unethical to give false hope, but it's also unethical to not provide grounded ethical hope. I will close with a little video done by an amazing gentleman. I think his birthday was yesterday or today, actually. Akin Salawu in New York. I was on the Oprah show once, and he put this video together afterwards, which is an amazing testament. And he has his own story of remarkable healing and recovery that is very special. So with that, I'll close. It's about 4 minutes long, I think. So thank you very much.